So we've discussed informed consent for a surgical procedure with the patient already, and now we're going to talk a little bit about an anesthesia consent form. On this agreement and consent, you'll notice that at the top it says, "I hereby give consent to Dr. so blank to perform the following procedures." So what should be filled in when the patient comes in? Certainly the patient's name, their date of birth should be filled in on the consent form. The doctor's name should be filled in. The anesthesia that's being used should be filled in. You'll notice that on the top two, intravenous sedation is labeled. In that first section it says intravenous and/or inhalational general anesthesia, deep sedation. I usually will check the first two. That allows us to use nitrous oxide if we need it. For instance, in setting up an IV, some patients prefer to have nitrous while they're getting an IV started. So I will check the first two. Intramuscular sedation, it's a unique circumstance and situation that leads to that, and we don't use it very often. Oral sedation, that also is a less common circumstance, and inhalational analgesia would be like a nitrous, and that would be nitrous alone. If these last three are needed during a procedure without IV anesthesia, that will be a case that the doctor will discuss with anybody who's setting up the case. So in this consent, it basically notes that the patient has been considered, that the treatment has been considered and discussed with the patient, and these are the things that I would discuss with the patient. One, that they are in agreement with the treatment plan to proceed with sedation. We've already confirmed that they haven't had anything to eat or drink for the period of time needed, and we discussed the complications as follows: drug reactions and side effects, pain, redness, swelling, reduced function, bruising, and or bleeding at injection sites, which are usually temporary but may be longer lasting. Nausea and vomiting may occur after the procedure. Drowsiness, possible injury to the nerves at injection sites, resulting in temporary or permanent tingling, numbness, pain of the areas or near where the injection was given. And then I word this last one mostly how it's written. Extremely rare complications of general anesthesia, such as severe allergic reaction, malignant hyperthermia, cardiac dysrhythmia or irregular heartbeat, cardiac arrest, vomiting with aspiration or breathing it in would require emergency transport, hospitalization, or even death. So it's okay to tell the patient that those are rare, that generally speaking IV sedation is a safe mode of treatment, that those things, albeit rare, are possible. And then common side effects you can discuss with the patient, and I like to give them a heads up on these, are dizziness, blurred vision, lack of coordination, muscle weakness, impaired judgment, drowsiness, or emotional volatility. I think that for some patients, it is a little bit concerning when they wake up and they feel emotional and they feel like they need to cry, they don't know why, but that is actually a side effect, and it's fairly common with IV sedation. So that's important for the patient to know. Oftentimes it's important for their family to know if their family is with them and seem extra attentive to what they're going to be like after. It's good to let them know that they might be emotional and crying after they wake up. So that's the basic gist of this consent form. I would encourage anyone who needs to review this with a patient to review it themselves first, to read it, and if they have any questions with the content on this consent form, to discuss that consent with me, and we can review it together. There's also one point here in the back. This is for female patients, but it is important for us to document. From young to old, All female patients will receive this question, and just initial that they understand that a procedure under IV anesthesia has potential to harm an unborn fetus, and that the patient verifies that they are not pregnant and want to move forward with the procedure. We don't choose who we do or don't ask that question. We ask it to all females, basically age 8 to 99.